Hi, everyone. We'll get started in just a couple minutes. Try to let folks continue to join and come in from the waiting room.
One of us need a mute.
You do, Sarah. All right, we're just going to wait another minute or so because it looks like people are still joining.
Hey, Kyla.
Hi, Terry. Glad to
Am I
see you.
Am I the only one here?
No, can you not see everybody else?
No, it's got to be my settings. Sorry.
Okay.
I'll mute myself now.
All right, gonna give another 30 seconds or so while people are joining, and then we'll go ahead and get started. Maybe I'll go ahead and make sure I can share my screen. Oh, Corey, it says that I don't have the ability to share my screen.
Okay, hang on just a second. Let me try that again, Kyla.
All right, thanks.
Corey, if you could make sure that I'm able to share my screen as well, that would be wonderful. Thank you.
You might want to test that. You're already a co-host, Ariel. So you should be able to, but Kyla, go ahead and check. There you go.
Looks like I'm okay now if you can see my screen.
Yes, we can.
Perfect. All right, well, I think we'll go ahead and get started. Thank you all for joining us this afternoon. We've got a couple of kind of related family survey topics that we wanted to both share information with you about, but also get input from you on and provide some information about upcoming opportunities to maybe participate in further conversations about Virginia's early intervention family survey. So I'm going to talk first a little bit about and get your input on a specific aspect of representativeness of our family survey responses and how we analyze our family survey data related to representativeness. And then Ariel's going to talk about response rate and representativeness a bit more broadly. As we get started, I would love it if you would take just a minute and in chat, tell us your role in early intervention or your relationship to early intervention, whether you're the parent of a child in early intervention, either now or previously, or you're a service coordinator or another provider. Maybe you're a local system manager or a VIC member or representing a state agency. See a number of local system managers, a service coordinator, a parent, DMAS, excellent, educator, previous parent, love that. Service coordinator, a clinician, developmental services provider. And some parent centers represented, really appreciate you participating today. So great. And again, welcome to all of you. So just a reminder, because we all have been in early intervention for longer or shorter periods of time, or may not know the ins and outs about the family survey, but we do a family survey annually to all families who are enrolled in early intervention as of January 1st of that particular year. And we use the family survey data in a number of ways, but one of the things we'll talk specifically about today is we use the results of the family survey to report on the 3 family outcomes that all states have to report on every year to the U.S. Department of Education, the Office of Special Education Programs, or OSEP, as we refer to them. And we also use that data in reporting to local systems on their progress or results on those same family outcomes. So this year, there is a new requirement in our reporting to OSEP in terms of representativeness. So in addition to reporting on our results on each of the 3 family outcomes, beginning this year, OSEP is also requiring all states to analyze the representativeness of survey responses based on race, ethnicity, and 1 additional demographic category. So in Virginia, we already analyze our survey representativeness based on race, ethnicity. We've done that for a few years now. And so basically what that means is that we look at whether the families who respond to the survey represent or look like the families that we serve. So for instance, if in early intervention, say 40% of the families that we serve are white, then we're looking to see, are about 40% of the families who respond to our survey white? Or if we serve about 25% of our families are Black or African American, is the percent of families who respond to the survey from that race ethnicity category, is it similar, right? So that's what we're talking about when we're talking about representativeness. So given that we already do race ethnicity, we just need to decide what is that other demographic category going to be. And before we talk specifically about that, I wanted us to just take a minute to think about why we care about representativeness. So why does it matter that the families who respond to the survey represent the population of families that we serve in early intervention? I'm just going to ask you to chat some of your thoughts about that. Why do we care about the representativeness of our family survey responses? To prevent certain demographics from being excluded, absolutely. To evaluate, monitor, and ensure equitable outcomes, ensure we're meeting the needs of all families, and because demographic factors can and do affect outcomes. Absolutely, these are all right on target. Scroll back up here. As families change, services may need to adjust to meet those changes. Equitable access. It's important that all feel included and that all needs are met, because we use the responses to determine next steps and outcomes. We need to ensure that the families who are participating are able to participate in decision-making. Great, yep. Inclusion, equity, bring new objectives and insights to make an impact. Yeah, absolutely, all of those things, right? Because we do want to make sure that the results that we see on the outcomes represent the results for all families. And we do use that data for decision making, right? In terms of how can we make improvements in our system, or what should those improvements be? We want to make sure that data is based on information that represents all families that we serve. Here. And so then if we think about that additional category we need to decide about, OSEP in putting forward the new requirement had some suggestions of possible categories we could consider, things like socioeconomic status, limited English proficiency, maternal education level, geographic location, age of the child, or another category approved through a stakeholder input process. So as we think about those, it's important to know that right now in Virginia, we have no way to link a survey response to a child and family's information and track it. So that's going to limit us a little bit at the moment in terms of what we can choose as our other demographic category. It's going to have to be something that we capture on our survey. We do hope down the line to be able to make that connection between survey responses and other data we have and track it. But right now, we're going to need to choose something that's captured on the survey. And on the right-hand side of the screen there, you can see we capture the child's gender, their age at referral, their age at the time of the survey, how long the child's been in early intervention, and their geographic location in terms of their local system. So I just wanted to get kind of a quick set of thoughts using a poll that Corey's going to help me out here with. And just see if you had to pick one of those, which one do you think would be the most important one for us to analyze our survey based on in terms of whether the responses we get are representative of the population that we serve? And we'll talk a little bit more in a minute about maybe why and see if this narrows it down a little bit for us, or if we're a little bit across the board. Wait just another little bit here. Got almost 75% of our participants have voted, so that's great. All right, looks like might have slowed down here. Corey, are we able to publish the results, or does everybody see them already?
Tell me, I just shared the results. Can you see them now, Kyla?
I can see them, yep. So we got about 48% saying geographic location. Next was 24% about how long in early intervention, and 21% age at referral. And then a couple of folks voting for gender. And Emily, you asked, what about something not currently on the survey? Again, for this, we need to start doing this with the reporting cycle that we're already in. So we're not able to add something different this time. But if you have a thought for moving forward about something we could add to our survey, or that we might want to eventually do, I would love to see any comments about that in chat as well. All right.
Kyla, you just let me know. Are you ready for me to stop to take that down?
Yeah, let me just capture. Will you be able to send this to me, Corey?
I can screenshot it if you'd like me
Perfect.
to.
Thank
Okay.
you. Okay. And then, yeah, it's fine to stop sharing. So I don't know if folks want to weigh in on chat. It looks like geographic location was a pretty far ahead. But if you had strong feelings about other categories or wanted to comment at all about why you voted the way you did, I think that would be helpful. So Emily's saying maybe socioeconomic status for the next round. And Emily, I don't know what you're thinking. I mean, yeah, we'd have to think about how we wanted to measure socioeconomic status, but that's certainly something we could look at. Yeah, I see a couple of thumbs up around that one.
Hello, this is Dana. So I want to make sure I understand, because I think socioeconomic status is really important. Right now, you cannot link to that response to go in and get that out of your data system. So it would be parent self-report at that time of the
Yes.
survey of what they would choose as their income. Okay.
Yes, and I guess we'd have to think about, I mean, in Track It in our data system, our proxy for socioeconomic status would probably have to be Medicaid or something around that kind of thing. We don't capture parent income. And I think we'd have to think about, it would be interesting to see how many parents would even respond to that question on the survey, would choose to provide that information. But certainly something we could look at. Someone comment, I chose age of referral due to the trend I see in pediatricians recommending wait and see approach, especially for families who speak more than one language at home. Interesting angle there. Can you explain what geographic location will look like as an additional category? The best we could do on geographic location right now would be the local system where the child was receiving services at the time. So one of our 40 local programs. And so those don't perfectly line up in terms of like rural, urban, or any of those kinds of things, but we would be able to check to see that the responses statewide are representative of services across the state, right? Let's see. So an income range is something that Emily had been thinking about with socioeconomic status. Could use zip code as a way in the future to look at location instead of local system. That'd be a bit more precise. Yep. Okay. Any other comments? If you use zip code, you could find local system current health and poverty rates in that city and county. Really good points. Yep. Yeah, it actually would allow us to slice and dice it in a number of different ways, because you could do the rural, urban, you could do, you know, some of those social determinants of health and other pieces. Oh, and Robin said she chose age at referral also due to the short amount of time the child might have received services. Yeah, the fact is that almost any of them would be interesting, right, in one way or another. And so even though OSEP is only requiring that we analyze it in 2 ways, you know, I think that it's something we can look at moving forward. We may eventually fold in other ways of looking at the data too. One of the things, you know, you have to watch is you don't get to the point where the categories are so small and you've got so few families in each one. And there will be more that we can analyze on a state level than we could at a local level, because you don't want to get down to things that could identify families. But I definitely appreciate the input on this, and we will take back those recommendations and thoughts for this year. And then, like I said, this isn't a permanent decision. We could choose to shift our second category to be something else, as we have the ability to either add questions to our survey or connect the data to track it. And we could choose to analyze more than one category as we move forward. So at this point, I am going to stop sharing. Please feel free to email me if you have, I'll put my email in the chat if you have any other thoughts after we get off the phone today. I'm always happy to hear those. And then I'm going to turn it over to Ariel, because I think that her presentation and some of her information really builds on this and takes us a little deeper into thinking about our family survey, the response rate, and representativeness. So Ariel.
All right. Hi, everyone. How are you doing today? I'm going to go ahead and share or attempt to share my screen. Let's see. Is it sharing it or no? If anybody can let me know.
Not yet, Ariel.
Okay, one sec. All right, so
There you go.
yay. Okay, I'm going to go ahead and just share this short slideshow and talk a little bit more about the Family Outcomes Survey. So we're talking about improving response rates and representativeness right now. Let's see. Again, I know Kyla explained a little bit about the family survey, but just as a recap, all Part C agencies under IDEA must report annually on 11 different indicators related to EI services. Some of those are things like, service setting, child find, transition, and timely services. But indicator 4 requires that we report the percent of families participating in Part C who report that early intervention services help their family A, know their rights, B, effectively communicate their child's needs, and C, help their children develop and learn. So states can, oops, my computer, there we go. States can choose how they gather this data. And we happen to use an 18-item impact on family scale. It's called the NC-SEAM. To measure the extent to which early intervention has helped their family achieve the outcomes mentioned in the previous slide. These questions include things like, it's got a leading statement, which is early intervention services helped me and or my family improve quality of life, feel confident in finding ways to meet my child's needs. And there are another 20 questions. And then we also include, Virginia includes an additional 4 questions that address families' experiences with the early intervention services they received. And these are things like, what I say about my child and family is understood and respected. I can get in touch with my service coordinator, that kind of thing gives us more information. We conduct this annually. Historically, it's been in March. It starts in March and is sent to everyone enrolled in early intervention. Right now, we have an online way to complete this survey, as well as it being mailed to families. And these results really do help us better serve Virginia families. And someone said something earlier that I really liked a lot, which was we use the responses to determine next steps and outcomes and ensure that the families participating are able to participate in decision making. And I really, really liked that. So that is the point. So we need to be able to rely on those results. They really do drive our program improvement activities, and we just want to make sure that everyone is being represented. Our response rate has actually been pretty good. Industry standards for like response rates for surveys really vary from anywhere from a good response rate being 5% to 50%. So, in 2020, 19%, and you can see that we've slowly climbed up to 22.5% in 2023, which is actually overall really great. Could always be better though. Now, when we break it down by race response by race, the Caucasian response rate has been higher than any other category. So although only 50.9% of the children served in state fiscal year 2023 were white, they represented 56% of the respondents to the survey. And in contrast, the group least represented compared to the actual population served has consistently been that Black or African American population. In 2023, only 13.2% of respondents identified as Black or African American, but they represent 20.8% of the children we serve. So that's a pretty big gap. But other group response rates are similar to the population served, and we define similar as less than 3% deviation from the actual population served. So the Hispanic population, the Asian population, they're all within 3% of the actual population served. This gives you an example of the distribution of child's race and ethnicity in our total sample, which is on the left side of the screen. So this has the actual number of people that responded and the actual percentage of respondents. And this shows on the right side of the screen, distribution in the representative sample. So our results are analyzed through ODU, the Social Science Research Center at ODU, and they provide us an analysis of all that survey data that we get. And they create a representative sample. So that gives us an actual breakdown of the results we get by the actual percentage of children that we serve. That makes sense. It's taking a moment to advance. So we want to change this pattern of, having one group that has a very high rate of response and other groups that have lower responses, so that we can increase the representativeness of these diverse families that we serve in Virginia. So right now, we are forming a work group comprised of stakeholders from across the state. So we need participants from diverse races, ethnicities, and regions, parents, providers, community leaders, LSMs, other early childhood professionals, and really just those with a vested interest in contributing to the well-being of our kids. The objectives of the work group are going to be to thoroughly explore all aspects of our current practices around family survey implementation, understand why some localities have higher response rates than others, why some families do or do not respond to the survey, and then really explore what changes to the survey tool or procedures would promote an increased response rate and a more representative response. And I am sure that people have lots of ideas about how we can improve that. So if you're interested at all, I have put my email address on the screen right there. You can also, I'm sure, email Kyla, but start here. Preferably by November 1st, if you can shoot me an email, but the commitment won't be extreme, once or twice a month, virtual meetings and maybe a little light reading in between. But please do email me if you are interested in this opportunity. Does anyone have any questions or comments? Stop sharing right there. All right, I'm going to hand it back over to Kyla.
All right, you did get a question here, Ariel, about when will the work group start?
There has not been a first meeting scheduled. So hopefully in the next month or two, we can start, once we gather a group of people together, can start figuring out what days, times will work for people, and we'll kind of go from there.
Yeah, I think the goal would be, if you think about our usual sort of survey calendar, right? We are gathering names and addresses at the beginning of a calendar year, and the survey's going out in the early, spring through the spring. So we wouldn't be in a place to be making big changes for this next survey round, but perhaps looking to have things figured out in time to be ready for the 2025 family survey.
And I can make these slides available. I know this is being recorded, but Kyla, I can send them to you, and actually I think you might have them.
Yeah, maybe once we can figure out about the recording and how we might post or link to that or send it out, we can send the slides as well.
Kyla or Ariel, this is Dana at VCU, is there an opportunity to provide stipends for families who participate in that work group for their time?
I think we could look at that. other questions or thoughts, ideas today? All right. If not, I hope we'll hear from you if you're interested in the work group or have any other ideas. Otherwise, we'll give you some time back. I know a number of us have a statewide local system managers call at 3 o'clock. Oh, Julie's asking, are the surveys always emailed to families?
So the surveys are available online. So they can get a link to the survey if they choose to do that, or if not, the survey is mailed to their home address. And we're also looking, I was just about to say, we're also, talking about, we're talking about that. It's definitely, I think, a possibility in the future.
Of using
Text.
Text. Yeah, I think that's one of the kinds of questions the work group is going to look at is the survey itself, how we get it out to families, how the options they have for returning it, any of those kinds of things that might be more appealing or increase the chance that a family is going to complete the survey. Mm-hmm.
Yeah, I see, Julie. Absolutely, lots of families really only communicate via text. I communicate via text for most things, so I get that. And it is available in different languages. It's available in Spanish and Arabic, I believe.
I think there are 7 languages now. Although it's very interesting when you look, we get a fair number of responses to the Spanish version, but across the other 7 languages, I think each year we get 1 or 2 surveys completed in a language other than Spanish or English. Also something we'd like to look at, whether there's something we could be doing different around that. And in terms of modalities, right now, as Ariel said, it's either completed on paper or online. When it gets sent out twice. There's a first round that goes out, and a few weeks later, a second survey goes out to those families who haven't yet responded. And after that second round, a couple more weeks go by, and any locality, any local system where there's fewer than 15 responses at that point, then ODU has staff make phone calls to families that haven't responded from those local systems and to try to get everybody to at least 15 responses. But right now, those are the options.
And those are all things we can talk about in the work group.
Yeah. It's really interesting when you talk to different states about how differently people do the family survey. Not every state uses the same survey. Not every state sends it out the same way or at the same time. The timing is another thing we could think about. Like I said, we do it once a year. So if you just choose all the families who are in early intervention at January 1st, right? Some of those families have been in early intervention for 3 weeks, and some of them have been in early intervention for 2 years. So we could think about the timing of how that survey goes out. Yeah, could families be given an option to complete the survey via phone for families that aren't literate? Yeah, I think those are all really good questions and things we should be thinking about.
Mm-hmm.
Read aloud would be worth consideration related to literacy and different learning styles. Mm-hmm. Yep. These are great ideas. I hope you all are emailing Ariel to be on the work group.
Yes, please.
These are excellent. So, all right. Well, I think Ariel and I can stay on for a few more minutes in case folks want to add any additional comments. But otherwise, thank you so much for joining us today and for your interest in helping us increase the response rate and representativeness of our family survey. We appreciate your ideas.